Hello, my name's Caitlin Shepard, and I'm chose to do my current event on the opioid epidemic throughout the United States. New government study claims that abuse of powerful prescription painkillers known as opioids cost the U.S. economy $53.3 billion each year. This $53.3 billion total accounts for direct health care costs, lost productivity, treatment, and costs to the criminal justice system. The rising cost of this epidemic is a major burden on the healthcare system. The amount of opioid-seeking patients is at an ultimate high. These seekers will do something known as doctor hopping, from place to place just to continue to get prescription painkillers. Once one doctor catches on or sees signs of addiction and then refuses to continue to supply the patient with prescription drugs, then they will move on to another physician. The research conducted that 2 million Americans abused or were dependent on prescription opioids. These numbers have been steadily increasing since 2007. Since 1999, the number of prescription opioids has quadrupled in the United States. However, Americans are not reporting any increase in the amount of pain they experience. This alone tells you that there is an addiction issue. As the amount of opioids prescribed in the United States has increased, so has the number of opioid-related overdoses. Deaths from prescription opioids such as oxycodone, hydrocodone, and methadone have quadrupled since 1999. This study conducted by the CDC also found that insurance covered most of the opioids being prescribed. These included Medicaid, Medicare, and other government-funded insurance programs. This is an important issue in the United States because of the financial burden it is causing on our healthcare system, along with the growing number of deaths associated with opioid overdose. Another issue with the opioid epidemic is that these prescribed opioids also serve as a gateway to heroin abuse. Once addicts can no longer seek prescriptions from their physicians, they turn to the quote-unquote street opioid, heroin. One of the major stakeholders in this issue are the physicians who are prescribing these medications so freely. I think that there are many physicians who look at prescribing a pain medication as an easy fix to their patients. A patient comes in, complains of back pain, and the doctor just writes a prescription and sends the patient on their way. By doing so, the patient gets what they want, and the doctor and pharmaceutical companies still get paid. I think that in order to get this opioid epidemic under control, instead of being so quick to write a prescription, the doctor should look for an explanation or proof that the patient actually has pain. And if they do find that the patient has pain, try forms of therapy or other alternatives before just prescribing addictive drugs. The financial burden being caused by this opioid epidemic will affect everyone which relies on the healthcare system. This is not only an issue within the United States, but is affecting people globally as well. In order to get this epidemic under control, we need to promote the use of state prescription drug monitoring programs. This will give healthcare providers information to improve patient safety and prevent abuse. Not only healthcare providers could play a role in stopping this epidemic, but law enforcement could also play a role by enforcing drug laws at their highest performance. Along with making these changes, I hope that the United States increases access to addiction treatment centers and support groups so that those who need it can seek help.